The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors. Welcome to another episode of TMD Demystified. I am Tony Urbanic. Today, we are going to cover the concept of willful ignorance and TMD/TMJ. Willful ignorance and TMD. I will explain what I mean by the title of this episode as we go along. Hopefully you'll stick with me, but willful ignorance plays a large part to play, an extremely large part to play, now thinking about it, as to why this problem has not been solved and why there continue to be literally millions and millions of people, primarily women, in the United States and America and beyond, that have this problem that goes almost indefinitely and ends up ruining their lives. That is a fact. No one disputes that. No one disputes how serious the problem can become. No one disputes how many people are involved. My findings over studying this problem for well over 40 years has been that the number of people has surprised me well and above what is usually considered the symptoms of TMD, because the major symptoms of TMD have been excluded. One of the major symptoms is migraine headaches. We've talked about that so many times before. And the confusion of migraine headaches and bad TMD headaches, which the more I treat these patients and the more I see of these patients, the closer those diagnoses become, where there's really not a significant distinction between migraine headaches and TMD headaches. And of course, the migraine headache scientists don't know what causes migraines. So it leaves one to really wonder what percentage of, quote, migraine headaches really exist. To be discussed later, to be determined later. But today, the concept to be discussed is willful ignorance and TMD. Now, what is willful ignorance? Well, let me start out by saying that some of you who watch these episodes and these videos may be aware, and some of you may not be aware, that I also do a weekly blog that is directed toward patients, the public. I do weekly blog and podcast virtual video episodes. The video episode is directed to my doctor colleagues, and the blog is directed to patients and published in several places and given access to our doctor colleagues, but published on our website, which is www.urbanictmj.com, and it can also be found at our practice website, which is www.urbanictmj.net, I believe. In any case, on the blog, which I write every Sunday night, and then it's published the next week, I wrote the blog with the exact same title. And for purposes of brevity, And just to get us started, I'd like to read to you the first 3 paragraphs of the blog, and then we will carry on with the topic at hand that is now would then be directed to only medical dental colleagues. So the first 3 paragraphs of this week's blog, entitled Willful Ignorance and TMD TMJ, is as follows. Excuse me for reading, but this is the easiest way to do it. Temporomandibular joint disorder is a devastating disease. It is a progressive disease which usually starts out with minimal symptoms. Once ignored, progresses into multiple symptoms, which eventually ruins the patient's ability to continue with life's normal functions and duties. It has been estimated that millions of workplace hours are missed each year in the U.S. because of TMD, TMJ. I have had several women admit to me they are ashamed of being bad mothers and not taking care of their children properly because of the symptoms associated with TMD, TMJ. And I have 2 documented cases of female patients admitting they were contemplating suicide because of their unrelenting TMD, TMJ symptoms. The responsibility to treat TMD, TMJ was given by default to the dental profession almost 90 years ago after an ENT surgeon, Dr. James Costin, recognized and published the first article about this disease in 1936, known thereafter as Costin's syndrome. The medical profession has no interest in treating a disease that was related to the muscles and the teeth attached to the jaw and associated with the jaw joints. This disease was given to the dentist to figure out and treat. Between 1936 and the mid-60s, dentistry ignored the problem completely. Around 1965, a few dentists began to consider that dental occlusion had possible influence on Costin's syndrome. By the early 1970s, the oral and maxillofacial surgeons had joined the fray, trying to ameliorate TMD symptoms with various surgical procedures. I was one of them. By the year 2010, most oral and maxillofacial surgeons had given up on trying to treat TMD surgically. I was one of them. And that is how the first 3 paragraphs on my blog this week started. Now, it goes on to talk about things that I would prefer to keep among us professionals and not relate directly to patients. So, what is willful ignorance about TMJ, related to TMJ? In my mind, is very visual. It is really very visual to me. And that is when, and I've, with 40 more years of talking to my dental colleagues, mostly general dentists and certainly oral and maxillofacial surgery colleagues and several other specialties, orthodontists, when the word TMD or the concept TMD, TMJ is mentioned, whether they do it actually or whether they just, you can see it in their eyes, the first thing they do is shut their ears. They don't want to hear anything about it. They don't want to know anything about it. They don't want to listen to anything about it. They'd rather have you not bring up the topic. So that is what is willful ignorance. That is the definition of willful ignorance. And that willful ignorance basically has rolled out to a greater degree as time goes on, not a lesser degree. And for various reasons I've kind of discussed, has a lot to do with what's going on in our dental schools and teaching programs of various kinds, but especially dental schools. But the dental community feels that they do not want to know anything about TMD, even though it is their responsibility to know and to treat. The medical community doesn't want anything to do with TMD. And because we see so many patients and so many patients referred by the medical community, PCPs, nurse practitioners, physician's assistants, immediate care clinics, ENTs, neurologists, that I get the word from the viewpoint of the healthcare professional, medical healthcare professional, through the eyes and through the words of the referred patients, which constantly come across. It's almost the same thing. I went to my PCP, I went to the ENT, I went to the immediate care clinic, and someone suspected that it wasn't something that they could deal with, and they thought it might be TMJ. Immediately they said, go to your dentist. Go to your dentist. Immediately when the first thought passed that medical profession's mind that it might be TMD, it was go to your dentist. The medical community wants nothing to do with TMD. They don't have a stake in it other than that they have to deal with patients and as I've talked many times before, confuse the symptoms with other medical diagnoses and end up going down rabbit holes and around in circles trying to use treatment modalities for misdiagnoses that go nowhere. I had a case of that yesterday where the patient had three separate medical diagnoses made because of their symptoms, and of course the workups and then the treatment on those symptoms later on that went nowhere, were not effective at all when actually the patient had inflammation within the temporomandibular joint, had TMD. So I had gone through three circuits, three separate medical types who went through various types of gyrations, which were certainly not effective because they weren't even trying to treat TMD. They were treating other diagnoses which had been misdiagnosed. So that is the problem. That is the definition of willful ignorance. The dentist don't want anything to know about it. And by the numbers, that's roughly 50% of the dentists. They will go, I don't want to know. They will tell you, I'm not interested. I don't want to know. And then the other 49% of the dentists, in my opinion, and it carries through because I've had so much experience, they treat the problem with a night guard and hope the patient doesn't come back. And that is also a form of willful ignorance, because unless they're right out of dental school and still believe what they were taught about night guards, they know a night guard is not going to help the problem. And that is why they hope they don't come back. They know a night guard is not going to work, and they hope the patient doesn't come back. That is also a form of willful ignorance. They don't want to know. And they just try to get rid of the patient one way or another. And that's the state of art, 2024, March the 5th. So the dentists don't want to know. That's the first category of willful ignorance. And the second category I already intimated and discussed briefly, and that was the physicians. They definitely don't want to know. It's not in their wheelhouse. It's not in their gameplay. TMD, jaw joint problems. It's attached to the teeth. It's attached to the jaw. It's attached to the oral structures. That's got to be a dental problem. Well, actually, no, it's not. And I've discussed that many times. But to make it clear, to clarify, when I treated temporomandibular joints surgically over 2,000 times over a period of 36 years, 2,000 cases, they were never considered dental. It was never considered covered in any way, shape, or form under dental insurance. Of course, that's a misnomer in itself. Dental coverage is not an insurance, it's a dental plan. I've discussed that on previous episodes. It's not insurance, it's a dental plan. You pay certain amount of, someone pays, you pay, your employer pays a certain amount of money, and then in return, you get roughly 2/3 of that back. So, and the third is kept by the insurance plan company, and then distributed the other 2/3 to cover minimal amount of dentistry. But in any case, physicians don't want anything to do with it, and they have a part to play in this willful ignorance because they don't want to know either. Now, why? Why is this case? What are all the reasons why this has happened? And so I made a brief list. I'm sure it's not complete, but I want to go over this because you can't develop a solution unless you actually know the problem. So you have to define the problem before you can develop or define the solution. So the problem is why all this willful ignorance, why all of the I don't want to know, or here's a night guard, knowing that it doesn't work, hoping the patient doesn't come back. Well, a series of things. Number one is that the dentists have no idea what the cause is. There had been multiple theories out there. The most common being the myofascial muscle theory. Admittedly, they call it the theory because they couldn't prove it, that it was theoretical, but it caught on. But no one really knew what the cause was. They couldn't pin it down. In a generic, simplified form, everybody knows nothing works. And that is what I've said to like hundreds of my dental colleagues throughout the years, hundreds and hundreds. No one disagrees. I go, yeah, we know nothing works. And we found that out. I found that out as a surgeon, finally gave up on surgery. I think that a lot of dentists make only a certain number of night guards until they quit giving up the night guards and they fall back to the position of, I don't want to know. Thirdly, the symptoms are very confusing. They don't seem to, in the natural state of things, the way pathophysiology is understood as you're taught in your basic sciences in dental school or medical school. When a patient comes in and says, I have pain on this side in the morning, and then I have a headache in the afternoon, and then if I open widely, it hurts right here, and it feels like it's cutting off my swallowing. I had a patient yesterday because of the mylohyoid symptoms. When she opened widely, mylohyoid got so tight. One of her major complaints was it felt like she couldn't swallow when this particular muscle got tight. And there's anatomical reasons why that happens. Or that they have upper back pain and arm, hand, finger tingling and numbness. And these disparate symptoms don't make any sense to the medical doctors, the nurse practitioners, or certainly not the dentists. And it's a confusing set of symptoms. And when you get confused, you finally give up and you go, I don't want to know anymore. Recent colleague of mine who wanted to get involved and find out the facts and the truth, his major concern was he didn't want to get married to the patient, married in quotes, married to the patients, plural, because in his mind, anyone who delved into the area of TMD treatment was going to have these patients just coming back and coming back and coming back and coming back with the same complaints. That's not a good thing. It's a lose for everyone. And all it does is create ill will rather than goodwill. And although that's not the truth around here, that's not the truth of what we see, that's not the truth of when you treat it appropriately with a device and protocol that literally just gets rid of the inflammation within the joint, patients don't come back. In fact, they don't want to come back. That is our biggest problem. It's like you get the patient started in the protocol, and a vast majority of them, they don't want to come back. They're fixed. As far as they're concerned, they're fixed. You can't get them back in the office. We're trying to handle that by beginning to have make available virtual checks or consultations, brief virtuals to check them afterwards, so they don't have to take their time to come back and make it more convenient to the patient. But getting married to a TMD patient is a large concern as to why there is a significant amount of willful ignorance. The next, not necessarily in line of importance, but could be at number one on the list, is there's nothing in it for the dentist. There's nothing that they can charge that compensates them for the time and the emotional anxiety that trying to treat someone that they believe has no successful possibilities of getting better. So, if there's not a financial reward and you're spending your time and your emotions trying to treat a patient, I can understand it gets very frustrating, at which point you eventually just turn off your ears and say, I don't want to know anything about it. Nothing in it for the practitioner. I've also spoken many times on a large number of doctors, including dentists, especially physicians, just think these patients are crazy. They're emotional wrecks. And some of them are emotional wrecks. I just noted in my introduction here that I have 2 documented patients, one on video who was unprompted. She just offered the fact she was so broken up when she first got in to see me that she told me that she was contemplating suicide and literally said that our service, my practice, was her last hope. She had heard blah-de-blah, that we had a solution. This video, I have it. If anyone wants to see it, contact me. I'd be happy to share it with you. Very compelling video. But these patients are not crazy. They're crazy with pain. They're crazy with emotion. They're crazy with the knowledge that no one can help them, and they know that they have these symptoms and that they're driving them nuts, literally. Well, you can't blame the patient on that, and you can't really, criticize the doctor too much for seeing what he sees. He's looking at a emotionally distraught patient who is extremely hard to communicate with because of her previous experiences. And then I think finally the one I can bring up is, you don't know how to treat the patient. If you did know how to treat the patient, that you think it's too complicated, because the other concept that is promulgated out there by a very few doctors who I call TMJ gurus, who intentionally want to make this problem complicated to treat, complicated to understand, complicated to treat, because it makes those doctors very special. Now, there are such things as specialists. Let's take up that just moment a little bit. As an oral and maxillofacial surgeon, all oral maxillofacial surgeons learn a broad scope of surgery, a lot of hospital surgery, orthognathic surgery, cleft palate surgery, in my case, nerve reconstruction. But we all learn the basics of extractions, impactions, dental implants, and things like that. But extractions, impactions, and dental implants, a long time ago, were not limited only to the oral and maxillofacial surgeon. And license-wise, and if you're experienced enough and if you can meet the standard of care, I have no problem with a general dentist doing surgery of any kind. He's not going to be able to do hospital reconstructive cases, but if he's experienced, if he's trained, if he can meet the standard of care and he can consistently get the results, I got no problem with a general dentist doing the work of a specialist oral and maxillofacial surgeon. But we now have a new specialty in facial pain doctors. And my experience so far is that they want to make this complicated to enhance their specialty. And I maintain, and you can fact check it, that the actual treatment by unloading the temporomandibular joint, decreasing the inflammation, unloading the joint with a simple oral device and protocol is not complicated. In fact, it's the antithesis of complication. It is just too simple. In fact, the patients can't believe it's that simple. And some of the doctors can't believe it's that simple, but it is quite simple. So it does not have to be complicated, but that is another reason that doctors think that they can't do it, they shouldn't do it, and they go into this willful ignorance about TMD. I don't want to know. And even if I did know, it was too complicated. So what this all ends up is in a circular defeat by both patients and doctors into a dwindling spiral, a dwindling, tightly wound spiral where at the end, everyone loses. The treating doctors lose, the potential dentist who can treat this, who are qualified to treat this with a minimal of knowledge. You certainly need to know some things, but it's not complicated. And a dwindling spiral of patients who eventually, a few of them even get to the point where they're contemplating suicide or telling someone that I know I'm a bad mother because I'm so short with my kids, but I can't stand the pain. I can't get through a day. I hope all of you can understand that. So what's the solution? I mean, I've defined the problem. I've defined what willful ignorance is. I'd like to see all the willful ignorance go by the wayside. That is my goal. That is my purpose. That is why I teach. That is why I do these episodes on TMD Demystified. So what's the solution? Let's go into the solution. Well, first of all, you have to take the blinders off. You know, if you continue to keep the blinders on, one-sided or no-sided bias, that nothing works, I can't stand these patients, I'm afraid of these patients, I don't want to get married to them. Well, that's just a point of view. So the first thing you have to do is you have to change your point of view. That doesn't cost anything. It isn't hard to do. You can just, at any moment in time, you can just finish your cup of coffee or your Coca-Cola and say, well, I've changed my point of view. I'm willing to listen. In other words, willing to do this rather than this. That's step one. Step one is just do this. I'm willing to listen. And then step two is ignore the bias and fixed ideas, because that's all they are. They're bias and fixed ideas that aren't based in fact. They're not based in reality. Patients are not crazy. Actually, when you understand the pathophysiology of inflammation within the temporomandibular joint, the symptoms are not confusing. I've explained it so many times. The symptoms are not confusing. You end up knowing exactly what causes it, and you understand that there is value to you and your practice, primarily because this is a medical problem without any CPT code, and it's a cash-only service, which is extremely valuable to any dental practice in the United States right now, and certainly not unacceptable and not unaccepted by the patients. We have no problem with the majority of our patients handling the fact that there is no insurance coverage for this solution. So thirdly, you must ignore the people who want to make this complicated. And it's not only the so-called TMJ gurus that want to make it complicated, but there are also a large proportion of the medical community that is hooked onto drugs and surgery, drugs of many kinds, including the Botox phenomenon. And it is a phenomenon. It's the best thing I can say about it. In the surgical group, there are still surgeons out there who want to treat TMD surgically to no avail. And by ignoring those who want to keep it complicated, the special interest, then you can begin to listen. So that brings me to the end then. If you would like to listen, first of all, it won't cost you anything to go back to prior episodes on TMD Demystified. This particular episode is episode number 141. That means that I've been doing these episodes now once a week for almost 3 years, and I've covered just about every technical, physiological, patient-wise concept having to do with this problem in detail in multiple places. And if you're patient enough and have enough time looking at some or all of those episodes, I think you'll get a much better viewpoint of the solution for TMD. It's quite simple. To say it again, if you can ameliorate, decrease, take away the inflammation within the temporomandibular joint by unloading the joint over a long enough period of time, all the symptoms diminish, go away. That's the nuts and bolts of it. We have a company that now promotes that, and we have our first nationally promoted seminar on April the 19th here in Nashville, Tennessee, in beautiful Franklin, just 10 miles south of Music City, USA. If you would like to know more about this seminar, which is basically a full-day seminar offering 6 CME credits for a very minimal fee, I think it's $395 for the day and 6 CME credits, including your lunch. You can contact our Chief Operating Officer, Naomi Williams, at naomi@tmjservices.net. You can also get tremendous amount of information off of our website if you want to learn more, and that is www.urbanictmj.com. I can be reached at any time. Don't hesitate to email me. To this point in time, I have never failed to respond to an email, which is tony@tmjservices.net. So if you would like to learn an actual real solution to the TMD dilemma, contact us, learn more, come to the seminar, watch more of these episodes on the podcast, get on our website and read over some of the blogs that I do on a weekly basis directed to patients. We have an independent university study that you can call and have sent to you. So all this information is available if you'd like the solution for TMD so that you can avoid any further willful ignorance on this topic. With that being said, I look forward to the next time that we meet. I certainly appreciate your attention and your interest in this problem. My goal not only is to solve the problem, which has been done, but to disseminate it widely for the benefit of my fellow practitioners, my colleagues, and especially for the patients. For today, I look forward to speaking with you next time. I am Tony Urbanic, and this is TMD Demystified.